Okay, welcome everyone. We have a short, brief window for this briefing, so we're going to go ahead and get started. Just a quick admin note before we start sharing information. Please remain on mute, and then due to the time limit, because we want to keep this, really tight, we're not going to have live Q&A, but you can certainly put questions in the chat and we'll do our best to kind of address those issues as they come in. But welcome everyone. Thank you for joining us. My name is Rebecca Milner and I'm International Medical Corps' Chief Advancement Officer. We're so glad that you took the time today to join us to talk a little bit about what's happening in the Ukraine and the escalating humanitarian crisis there. Many of you on this call have generously supported our response, so thank you. We couldn't do it without you. Your support is really what powers us and makes our response possible. So thank you very much. Today, I'm joined by Dr. Javed Ali, who's one of our directors for emergency response operations. And then we also have our colleague Simge Mamisoglu, our emergency response team lead in Poland. So Javed, why don't we just start with you? You've been working kind of 24 hours round the clock with our team inside Ukraine, and you'll be heading to Ukraine shortly. So why don't you kind of give us the situational overview of what's happening on the ground?
Hi, I hope you can hear me now.
Yes.
Good morning, good afternoon, and good evening. So, Rebecca, I'll try to be as brief as possible. I think there are a lot of reports coming out in the media, so I'll talk about what we are observing, what kind of information we are receiving from our partners from within Ukraine. So far, based on the reports that have been channeled through to us from the existing humanitarian platforms, they show that the situation is quite dire. There are the civilian casualties have been increasing because of the intensified fighting going on in the region. According to the humanitarian dashboard, those casualties are around 800 something, with about 250 deaths, of which about 15 are children. And with the number of injured individuals who do not find space or services in the hospitals that are, catering for victims of war. The other aspect of, in fact, recently we also had a chance to connect with the Ministry of Health in Ukraine, who basically gave us different numbers. According to them, they have seen about 2,500 victims hospitalized because of trauma, and they are primarily civilians with large number of deaths. So there is a disconnect between figures that are being reported versus figures that are coming from the frontline health facilities. But in order to, we all know that it's a war zone, so there will be, consequences on all fronts. But in order to gauge the magnitude of the crisis and its impact on the population well-being, I guess we'll have to look at various determinants of health and well-being. So if you look at the current situation, the escalation in insecurity, both in Kyiv and other areas, it will have a direct impact on health and well-being, certainly goes without saying. But what we are witnessing on top of that is there are these, on daily basis, new areas popping up on the map where, the front lines are constantly moving in. And these are currently termed as newly impacted areas. So recently we saw Odessa, for instance, added on the map, Sumy and other regions. So the security risk is immense. And because most of the fighting is happening in urban settings, the risk of collateral damage is extremely high. And it's shown also from the numbers that are being reported. Shelter damaged in residential areas and public health infrastructure due to the conflict is also quite widespread now. But the full extent, quite honestly, is still unknown. However, active hostilities and damage to residential areas are being reported all across. The one major change that we have seen over the last 1 week is that there's extreme rise or surge in food insecurity, and that's also because of the disruptions in supply chain lines, the markets not being refilled with the necessary products, and so on. And Water and sanitation has also been severely impacted, and it's particularly important because one, people need to have access to safe drinking water. Two, we are still in winters in Ukraine, and the heating system in these houses is largely based on the water system that have been devised. So all that together are impacting quite negatively, the health and well-being outcomes of the population. And on top of it, because of the applied martial law, there are restrictions to movement. So even those individuals who need to access basic health facilities, they are facing a number of challenges. In an environment with all these negative preconditions, the impact would be immense. It would certainly have an impact on access and availability of health services. The disruption in supply chain would not only impact, the service delivery, but also food insecurity and other, lack of basic necessary items. And for sure, the capacity to cater for victims of war in these hospitals. So I'll just stop there. It's just a brief rundown. But the worst part of all this is that this is not slowing down. It's going to get worse. And these are just preliminary numbers that are coming in. And once the humanitarian access is granted, and we see humanitarian corridor, and we go and witness, then we can testify to as what specifically has happened here. But I recall what happened in Darfur a couple of years, looking from afar the situation in Ukraine. So
right. Well, I mean, as people are fleeing the fighting, Simge, you're leading our efforts on the ground in Poland. Can you talk a little bit about what you're seeing at the border and give us a sense of how Ukrainian refugees are being received? And then also maybe just what we know in the, Romania, Moldova, Hungary area as well.
Okay, thank you, Rebecca. Hi, everyone. So I have been on the ground in Poland since the beginning of the crisis. And I got in touch with local stakeholders, Polish NGOs here in Warsaw. And I visited a border crossing in Rawa Ruska, which is one of the main border crossing from Ukraine. So what I've seen at the Polish side of the border was the families with small children who have just passed into Poland. And I've also seen Ukrainians who were already residing in Poland, but waiting for their families at the border. For instance, I met one Ukrainian guy who was waiting for his elderly mother. He was very nervous, and he said that he was waiting for her mother over 24 hours. So he was really worried how his mother was doing on the other side, waiting in the queue. So at the border as well, I've seen that local community got quickly mobilized, and they set up food distribution points and provided blankets as well for those waiting at the border area. So I talked to the authorities at the border crossing, and I wanted to cross to the other side of the border as well, just to have a look, see it from my own eyes, how the situation there. But they didn't suggest that I do that because it would take minimum 60 hours to get back. And they also told me that there are no food distribution points on the other side of the border. So then I couldn't pass. And so, those who so far passed into Poland from Ukraine, so those were with means, families and friends in Poland, so they knew where they were going. But now the people who are crossing, they don't have any means, and they don't have necessarily family and friends in Poland. So we know that the new refugees that are coming into Poland, they need support, they need accommodation. So Polish government actually quickly set up 9 reception centers along the border. So those without any pre-arranged accommodations, they go to these centers and they are being referred to bigger cities in Poland. So I also visited one of the reception centers in Lubice Królewska. So it was basically a complex of a primary school and a sport halls as well. So outside, you just see a big crowd, mostly women and children in big groups, and there are officials announcing the name of the big cities, Warsaw, Krakow, Lublin. People are trying to get into the buses to arrive to their final or temporary destination. So in this reception center, there's a meal area as well, just outside. There are hot meals, beverages, and inside in the big hall, I've seen a really, really big crowd. I mean, it was like literally like all the people were packed and there was no COVID measures whatsoever. And so I've seen that there's a, like U-shaped registration desk with at least 15 uniformed and non-uniformed staff trying to help refugees with accommodation in other cities. And also, I've seen the medical staff is in the premises, and I also been informed that there's a play area for children. And when I talked to the officials at the reception center, they informed me that they need food for children. But what I've seen was that actually they need more support than just food for children, because if the numbers continues increasing, I don't think that these reception centers will be able to accommodate any needs. And also looking at Romania and Moldova, so we also had a team member in Romania in the beginning of the crisis, and now we are trying to deploy a team in Romania and Moldova. We are overly concerned about the capacities of these countries, but especially Moldova, since they are not an EU member. So, looking at Poland, with EU membership and NATO membership and with government's interest in supporting Ukrainian refugees. So government is basically ready and have the capacity to provide many things to the refugees. But looking at on the other side of the border at both Moldova and Romania, we are also trying to shape our response to cover the needs on that side as well. Over.
So thank you, Javed and Simge. That's kind of a good overview of the situation. But Javed, let's go back to inside Ukraine. So for those that remain in the country, what are the immediate needs for the health system in particular, and kind of what's our response strategy, and how do we see ourselves kind of meeting those needs as the crisis grows?
Right. We are in a preliminary stage of, operational planning. So I'll just give you a rundown of what we have planned and why, perhaps, and perhaps relating to similar context where we have responded in the past. So as Simge mentioned, a lot of people are leaving, and on a daily basis you have more than 150,000 people crossing the borders, and the queue now is it takes about 60 hours for one person to pass, and those are as in many other countries, those are people who have means to leave the country. For those who are left behind, they're already vulnerable because of their socioeconomic status. But on top of it, they are much more closer to the conflict zones compared to those who were able to flee. Because in those areas, they still had access to transportation, they had means to leave the country. So in order to give a rundown of our operational plan, I would take a minute to basically paint a picture of why we came up with the plan. So I think one thing is very clear. There's war going on. There are bombardments, shelling. So we'll have a lot of patients with trauma and trauma-related incidents who would require acute life-saving surgical support. But on top of it, this particular event has also taken off the focus of the country from providing, at least access to life-saving services. And here I primarily mean, primary healthcare services where you have access to both preventive and curative services, because Ukraine is a country which has a very high burden of non-communicable diseases, diabetes, hypertension, cardiac illnesses, and so on. And these illnesses contribute to 80% of the mortality reported in the country. And the primary mean of having access to healthcare is through these primary healthcare facilities. And most of those health facilities have shifted their focus towards handling trauma cases. And on top of it, because of the movement restrictions, people do not have access to some of the functioning health facilities. So the primary healthcare network is not currently functioning. And on top of it, there are also certain other determinants here. The mental health needs are growing day by day. We have, there's plenty of data that talks about emerging mental health needs in conflict zones and areas with insecurity, and Ukraine is not any different. Even before the crisis, the burden of mental health illnesses was quite high, and this would be further triggered by this insecurity. So that's another area of focus for us. Protection services certainly is an area where we would provide our support, and we'll try to mend the gaps. And of course, a lot of infrastructure relating to WASH has been bombarded already, so people don't have access to food and water. So all these areas are priority, but our response plan at this particular moment focuses on sustaining at least access to emergency life-saving services, both for victims of trauma and as well as those who require, healthcare services to maintain their status of health. We have a multi-pronged approach. So with health activities on the forefront, we'll also integrate elements of mental health and psychosocial support, protection measures, basically distributing basic items of need. We have been trying to be as much beneficiary-centered as possible. So all in all, we have taken all the contextual elements into consideration. We have taken into consideration the impact on the health infrastructure in the country and the fact that this conflict probably is not going to end anytime soon. So based on that, we have come up with our plan. So our initial package is to support at least the frontline hospitals with all the necessary item, equipment, material, and commodities to sustain services for the victims of trauma. We have had multiple correspondences with partners and as well as with Ministry of Health in Ukraine, and we have received their requisition also to support them with these basic commodities. So as we speak, there are items in our procurement and supply chain pipelines, destined to reach Ukraine and those frontline health facilities. Once we establish, an operational access to those areas, then we'll try to respond with the whole complete integrated package of services that target primary healthcare service provision, non-communicable disease management, management of trauma, supporting hospital with surge units and surge facilities to deal with these mass casualty events, and provide services that relate to GBV and protection sectors, and so on and so forth. One key area that's emerging now, as usual with conflict zones, is that we are seeing unaccompanied minors. And in a couple of years ago, when we responded to Syria crisis, at one point we noticed that these unaccompanied minors account for almost 10% of the kids. So imagine 6 million population being displaced, of which at least 20% would be less than 5 years of age. And if you do the maths, and take 10% of it, it's going to be quite massive and challenging to provide those services. So all in all, yes, that's our plan to respond to this crisis. We do have experience of working in Ukraine. It's not the first time that we are working in the country. We have worked also in the insecure or non-governmental control part of Ukraine as well. We worked back in 2001, supporting health facilities with commodities. And since 2014, we have been working with them in providing wide array of services. So we are very much familiar with the context, very much familiar with the health infrastructure and the needs that existed before and the needs that are currently coming up. So all that has been taken into consideration to build our response plan.
Right. I mean, those two words, operational access, sound so simple, but it's very complex, right? And I mean, let's talk a little bit about our staff and our partners inside Ukraine. I mean, how their safety is, kind of our number one priority, right? To do what we can to help that. But talk a little bit about what are the challenges to operational access, I guess?
A number of challenges. Let me start with something that not many people are talking about. So there have been multiple reports of, attacks against healthcare workers and health facilities. At least one of it has been verified recently by WHO, but in reality, the total number of health facilities targeted so far is around 20. Healthcare workers are also being targeted. So that is one concern for us. But I mean, of course, it's a war zone. And since the conflict hotspots are in densely populated areas of Ukraine, there's a risk of collateral damage as well, being at the wrong place at the wrong time. And with the type of services that we normally offer in these sort of conflict areas, we try to be close to population that is displaced, population that is victimized, population that's close to the front line, so that we can provide those life-saving services. So there is insecurity that's prevailing, that is hampering operational access. And quite honestly, we have seen quite a belligerence from the Russian forces invading the country. So we're not even sure if international humanitarian law would be respected in this country. So that's another major concern. And with the supply chain issues in the country and infrastructure being severely damaged, would we be able to travel within these territories? Would we be able to communicate with our support networks in the region, in Romania, in Moldova, in Poland? That is also another challenge.
Right.
But there is some optimism there, because we experienced a similar situation in Tigray quite recently, in the beginning of the conflict. And as we speak, we have about 30 health services that are operational in the region, mobile health services. So we really hope that we will be able to negotiate that access. But at this particular moment, that's is quite challenging. So I would say one more issue. If I add, before this call, we were on a call with one of the potential partners who we would work with in Poland, and there has been an issue to basically import items into Ukraine because of the pipelines are not as smooth as they used to be. There are challenges getting these items into the country. So the commodity needs to be there when you start responding to the crisis. So yeah, all in all, those are a couple of challenges that we are currently maneuvering through, and hopefully we'll be able to have access very soon.
Right. There's a couple of questions about sort of just the overall, issues around ensuring that particularly vulnerable people are kept safe, whether they are third-party nationals or whether they are members of minority ethnic groups or people with disabilities. So can we talk a little bit about how the humanitarian community sort of ensures those kinds of support services, get to those populations that may be otherwise ignored or considered socially excluded in normal peace times?
So in Poland, we have been actually hearing at the border crossing, especially, that third country nationals are being either denied or they are being postponed across the border. And also the situation actually in Poland is also a bit similar. So they have limited access to the, existing humanitarian aid compared to, other refugees or Ukrainians. But within the Ukrainian community, we haven't heard any specific, smaller group, being denied access, etc. But we know that since the involvement of UNHCR in Poland, that the situation of the third country nationals, especially at the border crossing, have increased. But coming back to the question about the disability, people with disabilities. So I want to mention that there is no specific registration of refugees at the moment in Poland. And please think that, Poland is the most, developed neighboring country in the region. So if there's no registration even in Poland, so like they're not registering or they are not assessing any vulnerability of those who are entering. So they don't know who has any, chronic diseases, who has who has disabilities, etc., or who needs mental health services. So the government doesn't know this. So we are aware that there will be a really, really big gap in mental health and also services for people with disabilities in the near future.
Yeah, I mean, I guess that brings up a good point about coordination that really is key to humanitarian service provision. And while that sounds like it might not be a life-saving intervention, it is in a lot of ways. I don't know, Javed or Simki, if you have a comment about that, but I guess I just wanted to make that point because it's really about identifying where the gaps are and who can fill those.
Yeah, you're right, Rebecca. I mean, we have been in touch with the leading local organizations in Poland since day one, and there had been some coordination mechanisms being shaped up, and we are taking a part as International Medical Corps. We see that there's big amount of international actors are coming and they're trying to identify the needs, but we are always doing our best to work with local partners, to get their needs assessment, rather than creating this needs assessment fatigue as well. So yeah, you're right. Coordination is a big thing. Yeah.
Right.
And perhaps, Rebecca, I can add to it. I think, one challenge that we are facing, I mean, generally, humanitarian coordination platforms have matured quite a lot over the last many years. And lately, because of the COVID effect, we managed to develop a better, more organized coordination mechanism when responding to the crisis. But here we are talking about a region which is not as crowded as other regions in the world in terms of number of humanitarian actors. If you look at Ukraine, for instance, we are one of very few international organizations that is actually registered and present in the country on ground. Poland is a country where CSO infrastructure is not that well developed. It's a country that manages to meet its own needs. So that infrastructure is not there. And then, this is a crisis situation. So there are a lot of actors who are trying to come in to offer services. I mean, the enthusiasm is there. I think over the next 3-4 days, this would be a challenge to further, strengthen the coordination system and act a bit more maturely when it comes to these operational decision making. And I think that's where the global platforms will have to play its part as we are doing.
Right.
And hopefully we would be able to establish that. It always takes a bit of time in any crisis zone, but I believe we would be able to overcome this hurdle.
Right. Well, I mean, as we're coming to the end of our 30 minutes, I guess, International Medical Corps plans to be there for the long term. I mean, and Javed, you said yourself that we do anticipate that the impact of this crisis is going to go on for quite a while. I mean, I guess I would say over the next 6 months, International Medical Corps' sort of overall, response, goal, I guess, I'd say in cash dollars would be in the $15 to $20 million range. I mean, we really are striving to get that humanitarian corridor opened and get those medicines and supplies into Ukraine and into the hands of the health facilities that are serving people. But we will also be able to offer surge staffing support as well as mobile medical teams. And these mobile medical teams will be integrated and be offering both the medical services, mental health, and protection services. And so, I mean, I just want to appreciate everybody that's on the call that has supported the response. I mean, you are a big piece of this, and we will continue to keep everyone updated, as the situation on the ground evolves. But just really want to thank everybody for their time and effort. Simge, Javed, thank you very much. Javed, please stay safe as you're heading into the Ukraine. And Simge, thank you for all that you're doing to help us navigate the regional refugee crisis. But thank you, everybody, for joining us. And we look forward to staying in touch with everyone. Thank you.